Dear students, welcome back. In the previous session, we have seen three large flat muscles in the previous session. Now we are going to see the remaining muscles of the anterior abdominal wall. That is one large flat muscle and two small muscles. The muscles are the rectus abdominis muscle and the pyramidalis and cremaster muscle in this session. Now first we will see this rectus abdominis muscle. So this rectus abdominis muscle is having two heads. One is the lateral head and another one is the medial head. The lateral head originates from the pubic crest. So it is originating from the pubic crest. And the medial head is originating from the anterior pubic ligament in front of the pubic symphysis. And these two heads are getting inserted by three slips into fifth costal cartilage, sixth costal cartilage and the seventh costal cartilage, and also into the xiphoid process of the sternum. So this is the insertion of this rectus abdominis muscle. So the rectus abdominis muscle is getting inserted by three slips into fifth costal cartilage, sixth costal cartilage and the seventh costal cartilage, and then finally it is getting inserted into the xiphoid process of the sternum. And this muscle will have some peculiar feature called as tendinous intersections. The fibers of this muscle are straight and directed vertically upwards. So the fibers are directed vertically upwards. Okay, there are 3 or 4 tendinous intersections which cut through only the anterior part of the muscle. So such kind of intersections is not seen on the posterior aspect of this muscle. This kind of intersections can be seen only on the anterior part of this muscle. Okay, and these intersections never reach its posterior surface. The anterior wall of the rectus sheath. So this muscle is covered by a sheath called rectus sheath. So this sheath is firmly adherent, that means firmly attached into this tendinous intersections. Okay, now we can see the positions of these 3 or 4 tendinous intersections of the rectus abdominis muscle. Okay, the positions of the intersections are: one is at the level of the xiphoid process. We can see that at the level of the xiphoid process we can see one intersection, and also we can see at the level of the umbilicus. So we can see at the level of the umbilicus. Okay, so here, not here, at the level of the umbilicus we can see, so here, and in between these two we can have another intersection. In between these two we'll have another tendinous intersection. One is at the level of the xiphoid process and another one is near the umbilicus, and another intersection in between these two intersections. A fourth one may also seen below the level of umbilicus. So a fourth one is also seen below the level of umbilicus, and they said this intersection to represent the position of lumbar or abdominal ribs. Okay, and they serve, so mainly it helps to cut the long fibers of the muscle. So normally some of the fibers of this muscle are cut into short ones for improving the strength of their contractions. If there is long muscles, so the contraction may be decrease due to stretching of this overstretching of this muscle, and to improve the action of this muscle, they will cut the long fibers of this muscle to make into short for improving the strength of their contraction. Okay, so this is about the rectus abdominis muscle intersection. One is at the level of the xiphoid process, another one is the near the umbilicus, and in between them you'll have another intersection. Below the umbilicus you can find another intersection, normally which represents the position of lumbar or abdominal ribs. Okay, so this is about the origin and insertion and also the tendinous intersections of this rectus abdominis muscle, and this muscle is getting supplied by the lower 5 intercostal and subcostal nerves, so which enter the sheath through its posterior wall. Okay, so simply the nerve supply is by the lower 5 intercostal and subcostal nerves. Okay, the main action of this rectus abdominis muscle is it helps in the flexion of the trunk on the pelvis. Flexion of the trunk on the pelvis. So this is about the rectus abdominis muscle. And next muscles are the small muscles of the anterior abdominal wall. So the next one is the pyramidalis muscle. So the next one is the pyramidalis muscle. So this muscle is an inconstant. This muscle is an inconstant small flat muscle. So this is a small flat muscle, inconstant and small flat muscle, which is in triangular in shape, which is situated in front of the lower part of the rectus muscle. So this is the rectus abdominis muscle. So it is present in front of the lower part of this rectus muscle. So its origin is from the anterior surface of the body of the pubis by a rounded tendon, here. So, and this one is getting inserted, these fibers are getting inserted into the linea alba as far as the umbilicus. So this is getting inserted into the linea alba as far as the umbilicus, and this muscle is getting supplied by the subcostal nerve. So the pyramidalis muscle is supplied by subcostal nerve. The action is tensor of the linea alba. The action of the pyramidalis is the tensor of linea alba. And this is about the pyramidalis muscle. And the next small muscle of the anterior abdominal wall is the cremaster muscle. So here comes the cremaster muscle. So this cremaster muscle, here you can see both pictures. In this picture you can find how the fibers of this muscle run, and it is getting inserted in this picture. This is the whole cremaster muscle. This is the whole cremaster muscle. Okay. So the cremaster muscle and fascia arise as prolongations of the lower border of the internal oblique muscle. So this is the internal oblique muscle. So the fibers which are getting arising as the prolongations of the lower border of the internal internal oblique muscles. Okay. The muscle consists of loops of muscle fibers. Here you can see this muscle fibers consist of loops of muscle fibers. Here. So these are the loops of muscle fibers. of varying lengths with connective tissue in between them. And it is these loops, in between these two loops, some connective tissue is present. They arise from the anterior superior iliac spine. So they arise from the anterior superior iliac spine and the adjoining inguinal ligament descend on the anterolateral side of the spermatic cord. So here you can find this spermatic cord. So this is the spermatic cord. So spermatic cord, and then ascend up, and this fibers will ascend up. So here you can see it is getting ascending up on its posterior medial side. So on its posterior medial side, the fibers are getting ascending to insert by a tendon into the pubic crest. So on both sides. So on the pubic crest, these fibers are getting inserted. Okay, the shorter loops as they descend on the cord and attach it to it. So these shorter fibers will descend on the cord and are attached to the longer loops descend even into the scrotum to reach the testis. So the longer loops will reach to the testis also. Okay, so inside this it is having testis. So the longer loop descend even into the scrotum to reach the testis. Okay, this cremaster muscle is getting supplied by the genital branch of the genitofemoral nerve. By its contraction, the action of this cremaster muscle is, by its contraction, it pulls up the cord. This one is the spermatic cord. It pulls up the cord and testis and helps to support them. That is the action of this cremaster muscle. And this muscle also exhibit one kind of reflex called as cremasteric reflex. How this reflex is seen means, when the skin of the upper medial part of the thigh is stroked, there is a reflex contraction of this cremaster muscle, which can be seen as the elevation and elevation and retraction of the testis. So this reflex is more brisk in children and it is lost in upper motor neuron lesions above L1 level. So this is about the cremaster muscles. These are all about the muscles of the anterior abdominal wall. In the next session, we are going to see the rectus sheath in detail. Thank you.